Social news. Oral cancer. Scientists from IIT Kharagpur have built a portable, user-friendly and non-invasive device for detecting oral cancer. About oral cancer is also known as mouth cancer. It is cancer of the lining of the lips, mouth or upper throat. Cancer is one of the leading causes of morbidity and mortality in socially challenged and undeserved communities. There is an average 80% chance on average of 5-year survival rate. If diagnosed early, the survival rate drops to 65% or less. In the more advanced stages of the disease, in reality, most cases of oral cancers remained undetected until they reached an advanced stage. Moreover, there is a serious void of accurate yet affordable diagnostic tools to detect oral cancer in the pre-cancer or early cancer stages. What have the researchers developed for oral cancer? Researchers have built a low-cost handheld imaging device to screen oral cancer and pre-cancer based on the measured change in the blood flow rate of the tissue from thermal imaging and analytics. The National Institute of Biomedical Genomics NIBMG, funded by the Department of Biotechnology, has created the world's first database of genomic variations in oral cancer. Cancer burden in India. According to a study by FICCI and the EY, the total reported cancer incidence in India 2022 is estimated to be 19 to 20 lakh, whereas real incidence is likely to be 1.5 to 3 times more than the reported cases. 1 in every 10 Indians will develop cancer during their lifetime and 1 in 15 will die of the disease. The most common cancers in India are breast cancer, oral cancer, cervical cancer, lung cancer, stomach cancer, colorectal cancer. Oral cancer is the most prevalent form of cancer among men in India, largely fueled by tobacco chewing habits. NeoCov. Scientists in China have warned about a new strain of coronavirus, NeoCov, related to the Middle East Respiratory Syndrome MERS coronavirus. NeoCov is a bat coronavirus that has first identified in the year 2011. NeoCov was identified in species of bats known as Neoromica, which is where the name NeoCov was derived from. It is commonly known as the aloe bats. This species is distributed in the Afro-Malagasy region. It shares an 85% similarity to MERS-CoV in the genome sequence, make it the closest known relative of MERS-CoV. NeoCov carries with it the potentially combined high mortality rate of MERS-CoV, where on an average 1 in 3 infected people die, and the high transmission rate of the current SARS-CoV-2 coronavirus. It does not have the potential to use human ACE2 receptors and infect humans. Specific mutations of NeoCov can enhance its efficiency to interact with human ACE2 receptors. ACE2 is angiotensin converting enzyme 2. It is an enzyme attached to the membrane of cells located in the intestines, kidney, testis, gallbladder and heart. It lowers blood pressure by catalyzing the hydrolysis of angiotensin 2 into angiotensin. It serves as the entry point into cells for some coronaviruses, including SARS-CoV-2. Global Women's Health Tech. The two startups, namely Niramai Health Analytics and InAcell Technologies, have recently received the Global Women's Health Tech Awards. These two startups have received the support from the Department of Biotechnology (DBT) and BIRAC, launched by World Bank and the Consumer Technology Association (CTA) in August 2021. It aims to recognize innovative startups that leverage tech to improve women's health and safety in emerging markets. Categories. These awards were given about three categories: reproductive health, pregnancy, general women's and adolescent health, and women's safety and security. Award given to Niramai Health Analytics and InAcell Technologies for Niramai Health Analytics, NIRAMAI, Niramai Health Analytics. It has developed a software-based medical device that detects early-stage breast cancer in a simple and private way for women of all age groups, addressing a critical unmet need in cancer screening. The solution developed is a low-cost, accurate, automated, portable, contactless, radiation-free, and painless cancer screening tool with known side effects. InAcell Technologies Limited. It has developed a device named Fetal Light. It is a next-generation AI-powered fetal heart rate monitor based on fetal ECG signal extraction technology for mothers in labor or post 37 weeks of gestation. Ayushman Bharat Digital Mission (ABDM). The National Health Authority has announced the integration of its flagship Ayushman Bharat Digital Mission with Arogya Setu app, allowing users to create 14-digit unique Ayushman Bharat health account numbers from the app. It aims to provide digital health IDs for all Indian citizens to help hospitals, insurance firms, and citizens access health records electronically when required. Features. Health ID. It will be issued for every citizen and would also work as their health account. It will contain details of every test, every disease the doctors visited, the medicines taken under the diagnosis. It is free of cost and voluntary. Healthcare Facilities and Professionals Registry. It aims at creating a healthcare professionals registry and healthcare facilities registry, allowing easy electronic access to medical professionals and health infrastructure. It will be a comprehensive repository of all health professionals across both modern and traditional systems of medicine. It will have records of all the country's health facilities. Ayushman Bharat Digital Mission Sandbox. It will act as a framework for technology and product testing that will help organizations, including private players intending to be a part of the national digital health ecosystem, become a health information provider for health information user efficiency linked with building blocks of Ayushman Bharat Digital Mission. Implementing Agency. National Health Authority under the Ministry of Health and Family Welfare. 6 key building blocks of ABDM: Health ID, Dizzy Doctor, Health Facility Registry, Personal Health Records, E-Pharmacy, Telemedicine. Expected benefits. Ensure ease of doing business for doctors and hospitals and healthcare service providers. Enable access and exchange of longitudinal health records of citizens with their consent. Integrate the digital health ecosystem similar to the role played by the Unified Payments Interface in payments. Concerns. Misuse of data by private firms and bad actors due to the lack of data protection bill. Exclusive of citizens and denied healthcare due to faults in the system. National Health Authority (NHA). National Health Authority is the apex body responsible for implementing India's flagship public health insurance or assurance scheme called Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The National Health Authority is the successor of the National Health Agency, an attached office to the Ministry of Health and Family Welfare with full functional autonomy. NHA is governed by a governing board chaired by the Union Minister for Health and Family Welfare. To implement the scheme at the state level, state health agencies in the form of a society or trust have been set up by respective states with full operational autonomy over the implementation of the scheme in the state, including extending the coverage to non-SECC beneficiaries. The NHA is also working on a proposal to use fair price shops or ration shops for providing information related to the scheme and entitled under the scheme to eligible beneficiaries. National Health Authority. The National Health Authority is introducing a new system to measure and grade hospital performance under the flagship scheme Ayushman Bharat Pradhan Mantri Jan Arogya Yojana ABPMJAY. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is different. Ayushman Bharat Digital Mission is different. Sehat Initiative. The Ministry of Defence has launched services for home delivery of medicines for veterans and serving military personal services under an online medical consultation platform named Services, e-health assistance and teleconsultation Sehat SEHAT. Launched in May 2021, it is the tri-services teleconsultation service of the Ministry of Defence designed for all entitled personnel and their families. Sehat is a stay-home OPD is a patient-to-doctor system which aims to provide healthcare service to patients at their door. The Sehat OPD is a patient-to-doctor system where the patient can consult a doctor remotely through the internet. Furthermore, taking the healthcare delivery right to the patient's doorsteps, the Ministry of Defence launched another novel initiative of providing home delivery or self-pickup of medicines to patients seeking consultation on Sehat SEHAT. Sehat OPD is a patient to doctor system where the patient can consult a doctor remotely through the internet. Pradhan Mantri Jan Aushadhi Yojana. Jan Aushadhi Divas week to be observed 1st March to 7th March 2022. Theme of 4th Jan Aushadhi Divas. Jan Aushadhi Jan Upayogi. Jan Aushadhi Jan Upayogi. Initially launched in 2008, the scheme was rechristened in 2015. Implementing agency Pharmaceuticals and Medical Devices Bureau of India PMBI under the administrative control of the Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, Government of India. It seeks to provide quality medicines at affordable prices to the masses through special kendras known as Pradhan Mantri Bharatiya Jan Aushadhi Kendra. Salient features: ensure access to quality medicines, extend coverage of quality generic medicines so as to reduce the output of pocket expenditure on medicines and thereby redefine the unit cost of treatment per person. Create awareness about generic medicines through education and publicity so that quality is not synonymous with only high prices. A public program involving government, PSUs, private sector, NGO, societies, cooperative bodies and other institutions. Create demand for generic medicines by improving access to better healthcare through low treatment cost and easy availability wherever needed in all therapeutic categories. Key findings. Pradhan Mantri Bharatiya Jan Aushadhi Yojana. Create awareness about generic medicines. Give access to quality medicines through cover 8,675 Jan Aushadhi stores. Generate employment by engaging individual entrepreneurs in opening Pradhan Mantri Bharatiya Jan Aushadhi Yojana Pariyojana. Ensuring affordable healthcare for all. Medicines available at price less than 50 to 90% than that of to the open market. Surrogacy Regulation Act 2021. Recently, a petition was filed before Delhi High Court challenging the exclusion of a single man and a woman having a child from surrogacy, and demanded the decriminalization of commercial surrogacy. It came into effect January 2022. It allows altruistic surrogacy, wherein only the medical expenses and insurance coverage is provided by the couple to the surrogate mother during pregnancy. What the Act says: the Surrogacy Regulation Act 2021 is the first legislation in India on the subject. Under it, only heterosexual couples, widows and divorcees can avail of surrogacy. The Act recognizes only altruistic surrogacy, banning wombs for hire through a woman who is genetically related to those seeking a child. Only an ever married woman aged 25 to 35 years having a child of her own can be surrogate. Eligibility conditions: to make use of the services of a surrogate mother, any couple that has proven infertility. The couple should be Indian citizens who have been married for at least 5 years. The female must be between 23 to 50 years and the male 26 to 55 years. They cannot have any surviving children, biological, adopted or surrogate. However, this would not include a child who is mentally or physically challenged or suffers from life-threatening disorder or fatal illness. Condition to get surrogate mother: only a close relative to the couple can be a surrogate mother, one who is able to provide a medical fitness certificate. She should have been married with a child of her own and must be between 25 to 35 years, but can be a surrogate mother only once. Assisted reproductive technology (ART). ART is used to treat infertility. It includes fertility treatments that handle both a woman's egg and a man's sperm. It works by removing eggs from a woman's body and mixing them with sperm to make embryos. The embryos are then put back in the woman's body. In vitro fertilization (IVF). It is the most common and effective type of ART. ART procedures sometimes use donor eggs, donor sperm, or previously frozen embryos. It may also involve a surrogate carrier. Government to issue Health ID to newborns. National Health Authority. A National Health Authority (NHA) is developing a mechanism under which parents can generate Ayushman Bharat Health Account numbers known as Health IDs for their newborns and young children. Now, a person more than 18 years of age is entitled to enroll for Ayushman Bharat Health Account cards under Ayushman Bharat Digital Mission. ABHA number will enable parents to upload their all personal health records from birth as well as all healthcare benefits availed, ranging from the public health programs to insurance schemes. It will allow parents to track their children's health records. Shrestha, SHRESTHA. Ministry of Education has joined hands with the Ministry of Social Justice and Empowerment for Shrestha. About Shrestha, residential education for students in higher schools in targeted areas, aims to provide seats for the meritorious SC boys and girls in the best private residential schools in the country. Every year it is expected that about 3,000 students would be selected for admission in class 9 and class 11 under the scheme. Objectives of Shrestha: enhance reach of development intervention of the government and fill the gap in service deficient SCs dominant areas, earlier known as grant in aid to voluntary and other organizations for scheduled castes. Shrestha has two modes with Mode 1 to provide high quality residential education to bright scheduled caste SC students. Mode 2, it provides grant in aid to schools, hostels run by voluntary and other organizations meeting the required criteria. District administration is its prime implementing agency for Mode 1. Shabd Shala Initiative. The Commission for Scientific and Technical Terminology CSTT will soon launch the Shabd Shala Initiative. Shabd Shala is a website which will invite suggestions for the translation of words that are recent additions to the English language and are used widely in India. People across India can log onto the website and provide suggestions for possible translations of these words are the most prevalent usages in their respective languages. The suggestions will not be limited to only 22 languages covered under the 8th schedule. People can provide translations in other languages like Bhojpuri and Nagamis. Significance: selfie, drones, metaverse and artificial intelligence are among new technical English words that became a part of the Indian psyche and culture but have no formal translations into Indian languages. This initiative will help in finding standardized vernacular versions of these words in common usages. Commission for Scientific and Technical Terminology CSTT, established in 1961 by the Government of India under Article 344 Clause 4 of Indian Constitution, mandate to evolve technical terminology in all Indian languages, propagates its use and distribute it widely. Nodal Ministry: Department of Higher Education, Ministry of Education. Department of Higher Education under Ministry of Education. Nodal Ministry: Department of Higher Education, Ministry of Education. Headquarters New Delhi. Pradhan Mantri Matru Vandana Yojana. 5 years since its introduction, there is a vast scope for improvement in the Pradhan Mantri Matru Vandana Yojana. It is a maternity benefit program that is implemented in all the districts of the country in accordance with the provision of the National Food Security Act 2013. It is being implemented by the Ministry of Women and Child Development. It is a centrally sponsored scheme aimed to provide partial wage compensation to women for wage loss during childbirth and childcare, to provide conditions for safe delivery and good nutrition and feeding practices, to breastfeed the child during the first 6 months of the birth, as it is very vital the development of the child. Beneficiaries: pregnant women and lactating mothers, PW and LM who have their pregnancy on or after 1st January 2017 are eligible. The cash incentive is payable in 3 installments for the first live birth. Exclusion: PW and LM, pregnant women and lactating mothers who are in regular employment with the central or state government or PSUs, are those who receive similar benefits under any law. Benefits: under the scheme, pregnant women and lactating mothers receive a direct cash benefit transfer of 5,000 rupees in 3 installments. The amount will be credited to the beneficiary on fulfilling the respective conditions such as: first installment, early registration of pregnancy; second installment, antenatal checkup; third installment, registration of the birth of the child and completion of the first cycle of vaccination; The eligible beneficiaries also receive cash incentive under Janani Suraksha Yojana. Thus, on average, a beneficiary will get 6,000 rupees. Implementation. The scheme is being implemented under the platform of Integrated Child Development Scheme. Nari Shakti Puraskar. Recently, Nari Shakti Puraskar conferred on the International Women's Day 8th March. This is an initiative of the Ministry of Women and Child Development to acknowledge the exceptional contribution made by individuals and institutions to celebrate women as game changers and a catalyst of positive change in the society. Initiated in the year 1999, it is the highest civilian honor for women in India. The President of India confers the Nari Shakti Puraskar on the International Women's Day 8th March annually. The Nari Shakti Puraskar carries a cash award of 2 lakh rupees and a certificate for individuals and institutions. Eligibility. Any individual of at least 25 years of age and institutions having worked in the relevant field for at least 5 years are eligible to apply. The award is open to all individuals and institutions. International Women's Day 8th March. It is a global day celebrating the social, economic, cultural and political achievements of women. The day also marks a call to action for accelerating gender parity. International Women's Day was celebrated for the first time by the United Nations in 1975. Child Online Safety Toolkit. Britain-based NGO 5 Rights has released the Child Online Safety Toolkit with the aim to make online experience safe for children. Released by 5 Rights Foundation with support from the African Union, the United Nations Committee on the Rights of the Child, the European Union and other global children's rights NGOs. Aim to ensure children's rights and needs were prioritized in the digital world. Features of the toolkit. The toolkit provides a practical and accessible roadmap to create a digital world where children and young people are safe and fulfilled. It builds on existing international agreements and best practices developed in consultation with international experts from a range of background stages of the process. Any government can use the toolkit as a building block to work out its own culturally specific set of guidelines for online safety. Mission Vatsalya. The guidelines of the Ministry of Women and Child Development has mandated the states that to retain the official name of the Mission Vatsalya in order to access central funds and benefits under the scheme. About Mission Vatsalya is an umbrella scheme for child protection services CPS in the country. Mission Vatsalya promotes family-based non-institutional care of children in difficult circumstances based on the principle of institutionalization of children as a measure of the last report. Objectives of Mission Vatsalya. Secure a healthy and happy childhood for each and every child in India. Ensure opportunities to enable them to discover their full potential and assist them in flourishing in all respects in a sustained manner. Foster a sensitive, supportive and synchronized ecosystem for development of children. Assist states or union territories in delivering the mandate of the Juvenile Justice Act 2015 and achieve the SDG goals. Components under Mission Vatsalya. Improve functioning of statutory bodies, strengthen service delivery structure, upscale institutional care or services, encourage non-institutional community-based care, emergency outreach services, training and capacity building. Funds. The funds to states will be approved through the Mission Vatsalya Project Approval Board PAB, which will be chaired by the WCD Secretary, Women and Child Development Secretary. The WCD Secretary will scrutinize and approve annual plans and financial proposals received from states and duties for release of grants. Implementation. The scheme is implemented as centrally sponsored scheme by the Ministry of of the WCD Women and Child Development in partnership with state governments and UT administrations. Funding pattern. It is implemented with the fund sharing pattern in the 60:40% ratio. 60:40 ratio. However, the center and state or UTs will be share will be 90:10 for the 8th northeastern states as well as Himachal Pradesh, Uttarakhand and the UT of Jammu and Kashmir. The center will cover the whole cost of union territories without a legislature. SARA and CARA, SARA and CARA. Mission Vatsalya will support the state adoption resource agencies SARA. The SARA will coordinate, monitor and develop the work related to non-institutional care including adoption in the state. The SARA will support the central adoption resource authorities CARA in promoting in-country adoption and regulating inter-country adoption. Other features. Mission Vatsalya in partnership with states and districts will execute 24/7 helpline service for children as defined under JJ Act 2015. Separate children's homes based on gender including separate homes for transgender children and age will be established for children in need of care as well as for special needs children. The open shelters registered by the state government will also be supported to look after runaway children, missing children, trafficked children and other children who want special needs. Open shelters are not meant to provide permanent residential facilities for children but will complement the existing institutional care facilities. NPR versus Census. NPR, Citizenship Act 1955, Census, the Census Act 1948. NPR, it collects basic demographic data and biometric particulars. Census, a detailed questionnaire with 29 items to be filled up which aims at eliciting the particulars of every person including age, sex, marital status, children, occupation, birthplace, mother tongue, religion, disability and whether they belong to any scheduled caste or scheduled tribe. About Citizenship Act, it provides various ways in which citizenship may be acquired which includes birth, descent, registration, naturalization and by incorporation of the territory into India. It regulates the registration of overseas citizens of Indian cardholders and their rights. An OCA is entitled to some benefits such as multiple entry, multi-purpose, life-saving, lifelong visa to visit India. That is the Citizenship Amendment Act CAA 2019. It was introduced to amend Citizenship Act 1955. It provides citizenship on the basis of religion to 6 non-Muslim communities: Hindus, Sikhs, Buddhists, Jains, Parsis and Christians from Pakistan, Afghanistan and Bangladesh who entered India on or before 31st December 2014. It exempts the members of the 6 communities from any criminal case under the Foreigners Act 1946 and the Passport Act 1920. Action Agenda on Internal Displacement. Recently, United Nations Secretary General launched Action Agenda on Internal Displacement. Internally displaced persons, IDPs, are those people who are forced to flee their homes due to the armed conflict, generalized violence, violations of human rights, or natural or human-made disasters, climate change impacts, but who remain with their own country. It sets out commitments by the UN system to better resolve, prevent and address internal displacement crisis. The number of IDPs has reached more than 59 million people. India also saw approximately 4.9 million internal displacements in 2021. The challenges faced by IDPs: high risk of physical attack, the sexual assault and abduction. These people are deprived of adequate shelter, food and health services, etc. About the National Register of Citizens. It is a register prepared after the conduct of the census of 1951 for each village, showing the houses or holdings in a serial order and indicating against each house or holding the number of and the name of persons staying therein. It was published once in 1951 and has not been updated since then. Not updated NRC. It has been updated for only Assam, and the government plans to update it nationally as well. NPR versus NRC. NPR is the first step towards compilation of a national register of citizens. NRC as per the citizenship rules. National Register of Citizens NRC. After a list of residents is created or NPR, a nationwide NRC verifies the citizens from that list. Unlike the NRC, the NPR is not a citizenship enumeration drive, since it records even a foreigner staying in locally for more than 6 months. National Population Register NPR. The Ministry of Home Affairs recently highlighted the need to update the National Population Register database across the country in order to incorporate the changes due to birth, death and migration, for which demographic and other particulars of each family and individual are to be collected. About National Population Registrar. National Population Registrar. No supporting documents needed. NPR, a pan-India exercise excluding Assam, will seek information regarding the date and place of birth of a usual resident's mother and father, as well as his or her identity details like Aadhaar, passport, driving license and voter ID. A usual resident is defined as a person who has resided in an area for the past 6 months or more, or who intends to reside in that area for next 6 months. Data will be recorded as declared by respondent and no proof or supporting documents will be sought. Sharing Aadhaar, passport, driving license and voter ID details will be voluntary. PAN details won't be sought. No biometrics will be collected during NPR. No biometrics. National Population Register. No biometrics. So the same can be sourced from UIDAI if needed on the basis of Aadhaar. NPR was last prepared in 2010 along with census 2011, followed by updation in 2015. NPR is different. NRC is different. NRC means National Register of Citizens. NPR means National Population Register. About it is a database containing a list of all usual residents of the country. As usual resident is a person who has resided in a place for 6 months or more and intends to reside there for another 6 months or more. It is a mandatory for every usual resident of India to register the NPR, National Population Register. It is generated through house-to-house enumeration during the house listing phase of the census. It was first collected in 2010 and updated in 2015. Objective: to have a comprehensive identity database of people residing in the country. Legal framework: prepared under the Citizenship Act 1995 and the Citizenship, Registration of Citizens and Issue of National Identity Cards Rules 2003. Details required for NPR. The demographic details of every individual are required on 21 points, which includes date and place of birth of parents, last place of residence, permanent account number, Aadhaar number, a voluntary basis, voter ID card number, driving license number and mobile number. In the last NPR done in 2010, the data was collected on the 15 points and it did not include date and place of birth of parents and the last place of residence. Significance: streamline the data of residents across various platforms, better formulation of government policies and aids national security, better targeting of government beneficiaries, implementing the idea of one identity card which seeks to replace duplicate and solid documentations of Aadhaar card, voter ID, banking card, passport and more. NRC means National Register of Citizen. NPR means National Population Registry. Differently abled Divyang people, Divyang people. Accessible India campaign AIC. Accessible India campaign's targets will finally be achieved in June 2022. The Sugamya Bharat Abhiyan Accessible India campaign will complete 7 years in December 2022. Launched by Prime Minister of India on International Day of Persons with Disabilities on 3rd December 2015. For creating universal accessibility for persons with disabilities, the campaign has been divided into three verticals: built up environment, transportation sector, airports, railways, public transport and ICT ecosystem, websites and public documents, sign language interpreters and TV viewing. Aim to make a barrier free and conducive environment for Divyangs, persons with disabilities all over the country. Objective: to achieve universal accessibility for persons with disabilities. Nodal Ministry: Ministry of Social Justice and Empowerment. Implementing Agency: AIC is the national-wide flagship campaign for the Department of Environment of Persons with Disabilities, Ministry of Social Justice and Empowerment. Accessible India campaign: creating a barrier-free environment to ensure equal opportunities for persons with disabilities. Elderly and senior citizens. Rashtriya Vayoshree Yojana. The Ministry of Social Justice and Empowerment will distribute 4,800 daily living aids and assistive devices among 895 senior citizen beneficiaries under Rashtriya Vayoshree Yojana, launched in 2017. Nodal Ministry: Ministry of Social Justice and Empowerment. It is a central sector scheme funded from the Senior Citizens Welfare Fund. The fund was notified in the year 2016. All unclaimed amounts from small savings accounts, PPF and EPF are transferred to this fund. It aims to provide aids and assistive living devices to senior citizens belonging to below poverty line BPL category who suffer from age-related disabilities such as low vision, hearing impairment, loss of teeth and locomotor disabilities. The aids and assistive devices with walking sticks, elbow crutches, walkers or crutches, tripods or quadpads, hearing aids, wheelchairs, artificial dentures and spectacles are provided to eligible beneficiaries. Implementation: the scheme is being implemented by the Artificial Limbs Manufacturing Corporation ALIMCO, a PSU public sector undertaking under the Ministry of Social Justice and Empowerment. Population Census 2011. Population of senior citizens in India is 10.38 crore. More than 70% of the population of senior citizens live in rural areas of the country. A sizable percent, 5.2% of the senior citizens suffer from some sort of disabilities related to old age. Caring for senior citizens. Modi government to launch Rashtriya Vayoshree Yojana to provide free assistive devices for senior citizens below poverty line. Schemes to be launched on 25th March 2017 in Nellore, Andhra Pradesh. Similar camp scheduled on 26th March 2017 in Ujjain, Madhya Pradesh. Scheme to address disabilities like low vision, hearing impairment, loss of teeth and locomotor disability. Beneficiaries will get walkers, crutches, wheelchairs, tripods, spectacles, hearing aids and dentures. Following this campaign will be organized in 2 districts of each state for the entire year. Atal Vayo Abhyuday Yojana. Recently, the Minister of State for Social Justice and Empowerment has informed Lok Sabha about the Atal Vayo Abhyuday Yojana AVYAY. Atal Vayo Abhyuday Yojana AVYAY, promoting silver economy. Silver economy launched by the Ministry of Social Justice and Empowerment financially assists eligible startups engaged in the production of goods and services for senior citizens. The initiative is committed to providing innovative solutions to the problems commonly faced by senior citizens by promoting startups. Key features: the selected startups or startup ideas can be provided equity support of 1 crore rupees per project, while ensuring that the total government equity in the startup should not exceed 49%. The quantum of funding would be depend on the type of project, the scope of expansion, and the requirement of funds as per the project proposals. The scheme encourages entrepreneurs to think about the problems of the elderly and come out with innovative solutions. The government will provide up to 1 crore rupees as financial assistance through equity participation through an open invitation on a portal, namely Senior Care Aging Growth Engine. About status: Central Sector Scheme. Nodal Ministry: Ministry of Social Justice and Empowerment. Aim: to improve the quality of life of the senior citizens by providing basic amenities like shelter, food, medical care, and entertainment opportunities, and by encouraging productive and active aging through providing support. Sub schemes or components: Integrated Program for Senior Citizens, IPSRC. State Action Plan for Senior Citizens, SAP-SRC. Rashtriya Vayoshri Yojana, Senior Able Citizens for Re-employment in Dignity, SACRED. Actions Group aimed at social reconstruction, Senior Care Aging Growth Engine, Silver Economy for Senior Citizens, SAGE. Elderline, National Helpline for Senior Citizen. Channelizing the CSR fund for elderly care and training and capacity building for senior citizens. There has been a steady rise in the population of senior citizens in India. The number of elder persons increased 1.98 crore in 1951 to 7.6 crore in 2001 and 10.38 crore in 2011. बुजुर्गों की बात देश के साथ. यूनियन मिनिस्टर ऑफ कल्चर launches program बुजुर्गों की बात देश के साथ. He also launched an exhibition on Gita Govinda and a book Gita Govinda Jayadivas Divine Odyssey by Dr. Utpal K. The program बुजुर्गों की बात देश के साथ aims at enhancing the interaction between the youth and the elderly persons who are 95 years and above and thus have spent around 18 years in India before independence. Gita Govinda. The Gita Govinda is a work composed by the 12th century poet Jayadeva, contemporary of several other poets in the court of Lakshmana Sena of Bengal. It is a lyrical poem dramatizing the love sports of Krishna and Radha. The Gita Govinda consists of 12 chapters, further divided into 24 songs. Each song consists of 8 couplets. It is called Ashtapadi. Elderline. The Government of India has launched the first pan-India toll-free helpline 14567 for senior citizens called the Elderline. Launched by Ministry of Social Justice and Empowerment, Tata Trust and National Stock Exchange Foundation as technical partners are supporting the Ministry in operationalizing the Elderline. Elderline is the first pan-India toll-free helpline 14567 for senior citizens to provide free information about and guidance on pension and legal issues, extend emotional support and intervene in cases of abuse. The intent is basically to provide senior citizens or their well-wishers with one platform to connect and share their concerns, to get information and guidance on problems that they face on a day-to-day basis without having to struggle for it. Scheduled tribes, denotified tribes. 31st August marked the 70th year of the repeal of the Criminal Tribes Act 1871. DNTs, the most vulnerable and deprived, are communities that were notified as being born criminal during the British regime under Criminal Tribes Act 1871. DNTs are heterogeneous groups engaged in various occupations such as transport, key making, salt trading, entertaining, acrobats, snake charmers, jugglers and pastoralists. Criminal Tribes Act 1871 was repealed by Habitual Offenders Act 1952. Several DNTs were included in the Scheduled Tribe ST, Scheduled Caste SC and other backward caste OBC lists because they come from diverse social backgrounds. As per Renki Commission 2008, there are nearly 1500 nomadic and semi-nomadic tribes and 198 denotified tribes comprising 15 crore Indians. 31st August is celebrated as Vimukta Jatis Day in India by the DMT communities, DNT, denotified tribes communities. Ghar, Go Home and Reunite, portal for restoration and repartition of child. The National Commission for the Protection of Child Rights, NCPCR, has recently launched the Ghar, GHAR, Go Home and Reunite. About it, it addresses the changed roles of CWCs and District Child Protection DCPO for children in need of care and protection. The portal was developed by the NCPCR. The portal has digital tracking and monitoring of children who are in the juvenile justice system and need to be repatriated to another country or state in our district. The digital transfer of cases of children to the concerned JJB CWC of the state. It will help in speedy repatriation of children. List of government implemented schemes will be provided so that the time of restoration that CWCs can link the child with the schemes to strengthen the family and ensure that the child remains with his or her family. PM Cares for Children. Prime Minister Narendra Modi has released benefits under the PM Cares for Children scheme that supports those who lost their parents during COVID-19 pandemic. Launched in May 2021, the scheme has been launched for support and empowerment of COVID-19 affected children. Eligibility: all children who have lost both parents or surviving parents or legal guardian or adoptive parents due to COVID-19 will be supported under the scheme. The scheme aims to ensure comprehensive care and protection through boarding and lodging, health insurance cover of 5 lakh rupees, education, admission in schools, scholarship 20,000 rupees for all school going children, education loans for higher education, financial support till they attain the age of 23 years, financial support of 10 lakh rupees on attaining 23 years of age for self sufficient existence. A passbook of PM Cares for Children and health card under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana will be handed over to the children during the program. A portal was launched to register the children under the scheme. The portal is a single window system which facilitates approval process and all other assistance for children. Sologamy. A 24-year-old Vadodara woman, Kashma Bindu, on 2nd June 2022 announced that she would marry herself on June 11, 2022 in what she described as an act of self-love. The wedding is being seen on the first instances of self-marriage or sologamy in India. Sologamy is the act of marrying oneself in a public ceremony, also referred to as self-marriage or autogamy. While such a marriage has no legal sanction or status, the symbolic ceremony is used by many as act to emphasize their self-love and independence. Sologamy can be tracked back to Linda Baker, a dental hygienist from the US who married herself in 1993. It is widely considered the first publicized act of self marriage.